Now, there's a stark link between obesity and dying from COVID-19, according to new research. The report by the World Obesity Federation shows that excess weight is second only to age as factors when it comes to the death toll. 90% of deaths from COVID-19 are from countries with high rates of obesity. That's 2.2 million out of the total 2.5 million killed. It shows that mortality rates are 10 times higher, where at least 50% of the population is overweight. So that includes the US, Italy, and the UK. Now, on the other end of the scale, it shows no single country where less than 40% of the population was overweight has a high death rate. Well, we can now speak to Johanna Ralston. She's the Chief Executive of the World Obesity Federation, and she joins us now from Boston, Massachusetts. Joanna, thanks for taking the time to be with us. I want to start with the science behind this. How do we explain this correlation? How sure are we?
Well, the facts are the facts that we've mapped out the high correlation between obesity, between COVID death rates and countries with high rates of obesity. Similarly, we've seen in those countries with as you said, low levels of COVID death rates, low rates of obesity. So that's just what it is. And we know that there's factors, including sort of the inflammatory response, other factors that are still really emerging that are sort of have a causal relationship. But also there's associated factors like level of public health policy, level of adherence to recommendations and guidelines that probably play in as well.
We already know that poorer communities, often minority communities, are the ones who are likely to be potentially eating more poorly and therefore becoming more obese. So is this partly why we've seen such a disproportionate toll on those groups in places like the United States and the UK?
Absolutely, in places where the availability of healthier foods is much less in poorer communities. It's been called in the past food deserts. That definitely is a contributory factor, and we're actually seeing that all over the world. People living in lockdown, and unfortunately, in some cases, some aggressive and unfortunate marketing by food companies. But the reality is that often unhealthier foods are cheaper than their healthier counterparts as well. And so these are all factors. But obesity is not driven by any one factor. It's driven by multiple factors. So food plays a critical role, particularly ultra-processed food. But there's also there's genetics, there's a predisposition, family history, and even access to safe places for physical activity, which, again, are fewer in poorer communities.
Joanna, we were just mentioning there, obviously, age has come across as the biggest factor in terms of COVID mortality risk, but I see your report puts obesity second. So how do we tackle this? Is obesity then considered an underlying condition? Should it be for prioritized vaccinations, for instance?
We do believe that people with obesity should be prioritized for vaccinations, and that indeed that is happening sort of in a somewhat fragmented way around the world. Absolutely, the health concerns and conditions, quite frequently people with obesity do have other diseases in addition to obesity, and that would include diabetes, cardiovascular disease, cancer, but not solely. So it's absolutely people with obesity need to be prioritized for the vaccine.
Well, if COVID-19 is around to stay, as many experts suggest that it will be, this is clearly more reason yet to tackle the broader obesity epidemic. Now, given the disparity in incomes and access to nutrition that we were also speaking about earlier, how do we do that?
Well, it's not just it's not just access to nutrition. It's also access to health care. I think it's understanding obesity as a disease on par with diabetes, which is both a risk factor and a disease in its own right. And so that in the healthcare systems, and particularly in primary care in every part of the world, it's understood that obesity is a health condition that requires treatment. The treatment can include nutrition. It can also include physical activity. It can include pharmacological products. It can include surgery, which are slightly more costly interventions, but certainly possible in many environments. So it's really understanding it as a disease that's not meant to be stigmatized, which is unfortunately currently the case in many parts of the world, but in fact a disease that should be treated just like any other disease with a variety of approaches. There's many drivers of obesity, and therefore the solutions are manifold as well. And at World Obesity Federation and with our colleagues around the world, we've developed a root strategy, which stands for sort of the 5 pillars of an effective and comprehensive approach.
Joanna Ralston there, the Chief Executive of the World Obesity Federation. Thanks so much for joining us here on Al Jazeera. Thanks for your time, Joanna.
Thank you so much. Bye.